We had a very good hearing, joint hearing of the health committees of both the House and the Senate on the abortion clinic atrocity that happened in Philadelphia. And we had a very, very good hearing, engaging hearing with members of both the House and Senate asking questions, tremendous dialogue with the new Secretary of Health, being reassured that these abortion issues are going to be addressed and dealt with swiftly, and that the atrocities that transpired in the Philadelphia health clinic will not happen again. And very, very happy to see Governor Corbett taking swift action to make sure that these clinics are now fully and completely inspected, both announced and unannounced, and that appropriate action is taken to prohibit any further atrocities from happening. In regard to legislation that's needed, I have introduced legislation that will license and regulate abortion clinics under the ambulatory surgical center standards and require staffing and equipment and medical professional protocols be followed, such as ambulatory surgical centers already have in place. Obviously, these abortion clinics have not been under the same standards, and that will go a long way, I think, in improving the quality of health care and patient safety within these clinics. In addition, I have introduced legislation that will extend the statute of limitations with regard to infanticide. Infanticide was another recommendation from the grand jury in Philadelphia and the district attorney of Philadelphia to put it on par with homicide. And the grand jury was very, very upset that they could not file charges under infanticide because of the statute of limitations. And we're also going to be extending statute of limitations beyond 24 weeks for abortions, because the grand jury made recommendations that they wish they could have pursued additional charges against the culpable parties, but that they were limited to 2 years instead of 5 years. So we're going to be extending the statute of limitations to 5 years for illegal abortions beyond 24 weeks. And lastly, we're going to be rolling out legislation that criminalizes impersonating the doctor. I believe there may be a very weak statute on the books that basically puts doctors on par with notary publics. And obviously the standard of care and responsibility of doctors should have a higher level of criminal implication. So we hope to bump that up from a misdemeanor to a felony. So these are all bills, legislation that I hope meets with bipartisan support. They're all bills reflective of the grand jury recommendations. I believe they had about 15 recommendations in their grand jury report, and we are basically hoping to pass legislation that puts in statute at least 4 of those recommendations. Many of the other recommendations involved the City of Philadelphia's health department, the Department of Health in Pennsylvania, the Department of State in Pennsylvania, and many internal recommendations. The legislative recommendations we are nearly all adopting, hopefully in legislation sometime this session.